Social media, it's me, nurse practitioner Dr. Katina Kennedy, here with some health information for you. This is November 2017. That's American Diabetes Month. Diabetes is very, very prevalent in the African American and Hispanic and Native American population. But I wanted to know, when was the last time you had your blood sugar checked? Are you a pre-diabetic? You may be one. Some of the risk factors of diabetes are over the age of 45, having history of prediabetes, little or no physical activity. If that's you, then you need to get yourself checked out. Also, having a baby weighing more than 9 pounds or more, you're at risk for diabetes. Having gestational diabetes, if you've had diabetes during pregnancy, but after you lost the weight, that resolved. But if you had gestational diabetes, you are at risk. Also, if you've had immediate family, like your brother, sister, mom, dad, if they have diabetes, you are at risk. So if you have any of those risk factors, please go get yourself checked out. Some may ask, well, what are some symptoms of diabetes? Well, have you had increased thirst lately, frequent urination, feeling tired all the time, increased hunger no matter what, loss of weight without trying, blurred vision, any numbness, tingling in your fingers or the bottom of your feet or your toes, any sores that are slow to heal, or more infections than usual that takes a long time to heal. Those are some symptoms of diabetes. So if you're having any of those, please go get yourself checked out. Don't wait on that. What are your blood sugar numbers? When my patients come in and I check their blood sugar, we check what they call the glucose, all right? So we check that fasting. That should be less than 100. If it's over 100, then we do what they call a hemoglobin A1C. That's what I do in my practice. We do a hemoglobin A1C, and that checks the average of how your blood sugar has been running over the past 3 months. If your hemoglobin A1C is between 5.7 to 6.4, guess what? You are pre-diabetic. You are pre-diabetic, so that means you need to start doing some things that'll help prevent you from going into full-blown diabetes. If that hemoglobin A1C is 6.5 or higher, you are officially a diabetic. What are some things that you can do? You hear it all the time. Watch what you eat. Don't skip your meals. Exercise. Stay away from a lot of carbs, sugar-type foods. You can do it. You know what to do. I know it's hard. It's a lifestyle change. But if you have those risk factors that I talked about, you need to go ahead and be proactive in your health. Get yourself checked out. If you are pre-diabetic, lose that weight so that you won't become a diabetic. Stop skipping your meals. I promise you, things will get better. If you eat regularly and don't skip your meals, you will burn fat more that way as well. So those are some things that you can do. Diabetes Awareness Month is November. I've talked about diabetes in the past, but I'm here to educate you all that diabetes is serious. If you don't take care of diabetes, if your diabetes is not controlled, this can cause eye problems. This can cause amputation of your limbs, of your toes, your legs, below the knee amputation. We see it, blindness, kidney dysfunction, kidney damage. All right, so take control of your diabetes if you have diabetes. If you're pre-diabetic, you know what you got to do to prevent yourself from becoming a diabetic. It's serious. We got to break this cycle. We got to start living healthy. Take care. Don't forget to follow me on my social media, YouTube, Instagram. It's all different information on different social media platforms. Take care.